Ibrutinib is a molecule that inhibits B-cell receptor signaling. And one of the subtypes of diffuse large B-cell lymphoma, called the ABC subtype, is driven by B-cell receptor signaling. And so what we've decided to do is treat patients with ibrutinib in combination with two other agents. One is lenalidomide, which is known also to be active in this subtype of diffuse large B-cell lymphoma, as well as Rituxan. The design of this trial is a 1B/2, where we first determine the safety of the combination, and in the phase 2 portion, we test the combination at the maximum tolerated dose. So this trial will be presented by Dr. Gua as an oral presentation this year, and I can give you a preview of some of the information that's gathered from that trial. In that study, we had shown that ibrutinib, along with lenalidomide and Rituxan, was well tolerated, up to a dose of lenalidomide of 25 milligrams. And in addition, when we looked at the activity of ibrutinib, basically in the non-GCB subtype, which is the subtype that enriches for the activated B-cell subtype of diffuse large B-cell lymphoma, we had a high overall response rate, and we had several patients who did not progress for over a year. Now that's important because in this patient population we studied, 2/3 of them were refractory to therapy, chemotherapy, and 1/3 were primary refractory patients, meaning they had never responded to chemotherapy at their first treatment. And despite a very heavily pretreated patient population that had 3 prior lines of therapy, our overall response rate was near 60%, and again, durable in many patients. So we believe that this combination will be an exciting non-chemotherapy, potentially exciting non-chemotherapy approach for patients with diffuse large B-cell. We are now expanding the 1B into the phase 2, and once we have phase 2 data, we can determine what steps we want to take from there. But thus far, very exciting early data.